Spondylolisthesis is one of the diagnoses that you might get if you've got lower back pain or sciatica, and it means one of the vertebrae, the bottom part of your spine, is shifting forwards, most commonly L4-5 and L5-S1. And one of the great stretches, if not the best stretch that we recommend our patients and members with back pain, is the towel stretch. But because of some specific peculiarities around spondylolisthesis, you might be wondering if this is for you. Well, in today's video, we're going to explain how the towel works, how it works in context with spondylolisthesis, and hopefully give you the confidence to benefit from this absolutely great stretch. If you're new here, welcome. I'm Michael Fatica, the lead osteopath and spine specialist here at Back in Shape. We help people around the UK and all over the world fix their back pain from home and get back in shape for the long term. And today, we're going to cover this difficult topic so that you, if you're struggling with spondylolisthesis, can have a bit more clarity. Not only with this towel stretch, but how to move forwards to rebuild back resilience and health for the long term. Because we've had countless patients and members over the years who start off understandably in a bit of a difficult circumstance. They're not really sure what to do and they're worried about the vulnerabilities in the lower back. But once you've got the understanding, you can build it with the confidence and the right rehab, and you'll be well on your way to getting back to doing the things that you want to do again. So the first thing to understand is the big challenge that those of you with spondylolisthesis face, because the normal movements of the lower back are forward, backward, twisting, sideways, left, right, etc. But this shearing that takes place, you'll notice on the model, I can't do a spondylolisthesis because the structure of the lumbar spine and the supporting structures make sure that those vertebrae don't shear forwards on one another. Now, the most common area to get the spondylolisthesis is going to be L4-5 and L5-S1, and that's the last two vertebrae of the lumbar spine slipping on the one underneath. So in the 4-5, it's this vertebra sliding forwards towards you guys on the L5, and in the case of the L5-S1, it's the L5 vertebra sliding forwards on the sacral base, or the S1, the sacrum. These are typically graded on grade 1 through to 4, 4 being a complete slippage, so where the one vertebra slides completely off, and grade 1 and 2 being much more common, being 25 and 50% slipped forwards. And the vast majority of you watching this video are probably going to be somewhere between grade 0 to 1 or 1 to 2. And herein lies the challenge. Because the vertebra is moving forwards, you are instructed, rightly so, to avoid any backward bending. So stretches like the cobra and forcing the extension movement through the lumbar spine, which is an increase in the normal lumbar curve, is something that you want to avoid. But at the same time, which is often less frequently discovered or discussed, is that you should also be avoiding forward bending. And why is this? It's down to the discs. The discs are great at resisting compression in a straight line, one vertebra squashing down onto the other. But as soon as we've got that forward sliding, it's coming down at an angle. The fibers of the disc are going to be off to a slant rather than directly in alignment with the pressure that's coming through the spine, and they just don't tend to work so well. And unfortunately, when we're then doing movements like squatting down and curling up into a ball to relieve some of the pain, as is so common for those with spondylolisthesis, or hugging the knees to try and alleviate the pain and enlarge the space on the back part of the spine, that gets us into trouble because we're aggravating that disc that is under significantly greater and abnormal load and strain compared to if it wasn't a spondylolisthesis and it was just a straight disc bulge. So you're in this position thinking, well, I can't bend forwards because that's not going to work. It just becomes diminishing reward for practice invested. You do a stretch, you feel bad again. You do a stretch, you feel better for a moment, you feel bad again. And you can't bend backwards either because that's not going to be a good thing to do. So what do you do to provide some relief for that lower back? Well, this is why we recommend the towel stretch. And I'm going to cover it very briefly here. You'll see some videos on the screen as well. And then we'll go into some points specifically for those of you with spondylolisthesis, because you'll rightly be thinking, okay, wait a second, but is that not extension? So bear with me and we will address all of these concerns in this video. That's why we've put it together. So what we're essentially going to be doing is we're going to be taking a rolled up towel about this size, so it's kind of 3-4 inches in diameter, and we're going to place that underneath the lumbar spine. So what that's going to look like on the spine is going to be here, where it's supporting the natural lordosis. It's important to understand that the natural lordosis does have a backward bend to it. And what we're looking to do, for those of you with spondies, is to hold that spine steady. It's to not increase the curve and it's not to reduce the curve significantly. We want to hold it steady. And the towel does a great job of supporting that natural curve. And what you're simply going to do is you're going to lie on your back with your knees bent in this position here. You're going to engage your core brace nicely. You're going to lift your bum up off the floor, and then you're going to slide the towel in from the slide, then lower yourself back over. You're going to keep your knees bent and your feet on the floor. You might stay there for something like 20 seconds, up to 3 to 5 minutes once you're comfortable with this. And then you're going to hold everything steady. And like this spine is going to do, you're going to roll off to the side. Note there was no twisting or anything like that as you do this. Give yourself a few moments once you're on your side, and then you can pop yourself up. Now you might be thinking, hold on a second, Mike, isn't that towel pushing me into extension? And so we've got these next questions to help you understand this a little bit more, because it's not quite as simple as that. So firstly, as we mentioned a moment ago, the neutral spine is this position. Many of you will be actually flexing and flattening the lumbar spine, and that's not going to be helpful. We just want to simply support the natural lordosis, and that's all the towel is doing. And the lordosis, for those of you that don't know, is just this natural backward bending curve. We have a backward bending curve, which is neutral in the lower back, and we also have a backward bending curve, which is neutral in the neck, and we have a forward bending curve, which is called a kyphosis, which is in the middle back. The second point of note here is that the towel is not pushing forwards the target segment. And for the sake of this example, I'll just talk about L4, L5, spondylolisthesis, so L4 slipping forward on L5. You'll notice on the back of the vertebra here, we're not pressing directly onto the L4 segment as we push. The towel is in contact with really L3, L4, L5, and S1. So it is simply supporting the natural curve rather than poking like a Jenga block one of the vertebrae forwards. That would obviously be a very bad idea. The towel, on the other hand, is very, very broad in its application. So it is simply supporting that natural curve. So when we're actually doing the towel stretch, it's doing three key things, really. Number one, it is, of course, supporting that natural lordosis. Many of us spend way too much time sitting down every day. That's flattening and eliminating the lordosis, moving into flexion, aggravating the disc component of the problem. And therefore, just having that moment to put you back to neutral, not extended, but neutral and supported by the towel is great. Number two, when we are over the towel, we get a slight elongation of the lumbar spine, which takes pressure very, very gently off these discs by just opening those spaces out and just alleviating some of that compression through the spine without a significant amount of extension beyond neutral. The third point really pertains to the muscle stiffness and feelings of tension that you have in the lower back. Often these feelings on the back here are tension because there's a flattening taking place in the lumbar spine from the daily activities, etc. And therefore, when we lie over the towel, it simply allows those muscles and ligaments on this part of the spine to have a bit of respite, to relax, to get the tension taken off them too. The additional benefits of the towel are a couple. You can make the towel a little bit smaller if you want to, and you can make the towel a little bit larger if you want to. Some people, and it's very difficult to predict other than just trying, will find that a smaller towel actually helps them ease into this exercise. Conversely, others will find that a larger towel does. And that's perfectly okay. Experiment with a few seconds, maybe 15, 20 seconds, to see if one actually feels a little bit more comfortable for you to relax over compared to the other. And then additionally, we've got the fact that everybody can do this. You don't need any special equipment. It doesn't cost tons of money. You can do it on the bed. You can do it on the floor. Floor being obviously best, but you might struggle to get down there in the early days of back pain. So we really have an exercise or a stretch that absolutely everyone can do to take strain off that injured and vulnerable section of the lower back. And just as a side note here, many of our members, whether they've got spondylolisthesis or not, will find that the towel often is a bit uncomfortable to start with. That's entirely normal. Be careful when you get on, be careful when you get off. That's really goes without saying. But gradually you will find, like so many others, just like you, that actually this stretch is something that they look forward to. They can't wait to get home and just lie on that towel for a few moments just to ease some of the tension. It really is one that we consider to be a back health essential. No matter whether you've had surgery, whether you haven't had surgery, whether you've got a minor back pain or you've got some more severe back pain, as long as you approach it sensibly, assess your tolerance and move forwards carefully, you'll find this really is something that opposes the stress and strain that develops on that lumbar spine from daily life. So one of the most important things to bear in mind whenever we're doing any exercise is often it's not even the exercise that we're doing, but it's how we're actually going about that exercise that actually gives the errors, if you will. And please know that this towel stretch is like one of the most gentle things you could possibly do. Like it's going to be difficult for you to find something in your daily activity that is less strain on the back than the towel exercise. That being said, sometimes when we do things a little bit wrong, we get a little bit of a flare-up, a little bit of inflammation in that lower back. And understand that because the stakes are so low here, the strains and the forces at play are so low, even if we do get a little bit of a flare-up, it's not going to be causing significant objective damage, as opposed to if we were going in the gym with like 100 kilos on our back, trying a single-legged squat or something like that. There's a lot more force at play, so it's a lot more reasonable to assume that we might be exposing ourselves to the possibility of more objective damage in the lower back. And that's the big thing with people with spondies. You really want to know, or even any disc herniation for that matter, you want to really be sure that you're not going to make things worse. That's the biggest thing up here that worries people. And knowing that the towel exercise is such a simple one that the risk of objective damage is almost nil. Now, that's not a challenge, so please don't try any crazy stuff. But if you follow some of these extra tips and mistakes and avoid them, then you're going to be in really good position to benefit maximally from this great stretch. So firstly, simple. Do not roll backwards over the towel. Don't put it behind you and do a reverse sit-up. That is going to be bad and likely cause a lot of discomfort. And in the same vein, when you finish, don't do a big sit-up to get off the towel. That's a bad idea, and again, going to be putting a lot of strain on the lower back in ways that are completely unrelated to the stretch and just a bad thing to do. We've already covered it earlier, but do not twist when you're getting off the towel. It is a bit of a practice thing. You will get better at it, but you use your toes and a bit of momentum from the upper body to slowly move off and roll to one side off the towel. It is something you'll get better at, but we should not be twisting that lumbar spine after we finish to get off. Do not lift your bum. Do not do a glute bridge after the towel. Now, you have to do the glute bridge at the start. You have a core engaged nicely, etc. When we finish, we always roll to the side. We do not lift our bum up or anything like that when we finish. For those of you with spondies, this is a bit of a difficult one because some people do actually find later on that it is quite nice, but do not lie with your legs stretched out. Certainly not when you're getting to grips with this stretch. You might find in the future that actually it is quite comfortable and helps you, but for most, it's a general good idea not to straighten the legs and keep the knees bent with the feet on the floor. And the final one, you wouldn't believe how many people actually get caught out by this, and it's how you go about getting on the floor. If you're struggling with your lower back, you can't move very well, and it's quite severe, maybe you've got tremendous symptoms into the legs, then getting down on the floor can be a bit of a challenge. So give yourself some support. Don't just flop down on there or fall onto the floor when you do this. Be careful, try and keep a neutral spine, try and keep yourself controlled, and get onto the floor and back up again safely and in a reasonable amount of time. Don't rush. The last thing you want to do is rush to get up to go let the dog out or get the doorbell. Those sorts of things are nothing to do with the towel. And if you are unlucky enough to get caught out by them, that's fine. Just go about some standard protocols that we recommend usually to relieve some of the strain and reduce the inflammation, such as contrast bathing, etc. But that's got nothing to do with the towel itself. So try and set yourself up for a time when you're going to do this, where you're not going to be disturbed, the doorbell's not going to ring, or someone else can get it, and you can just focus on relaxing and getting the benefit from this great stretch without undermining it with something that could have easily been avoided. Now, it's all well and good doing this great stretch, and this is something that you can lean on. It's part of one of the routines we've got on the website, which is a back-friendly routine. It's there to relieve the strain builds up in your lower back. But it's not going to be complete and give you kind of resolution of this spondylolisthesis and the pain associated with it without actually doing the proper rehabilitative work. And I'll go through a few principles to help you with that. You've got to make sure you are actually strengthening up at the same time. And inevitably, the process of strengthening is going to put some load back on the spine, which is why this towel stretch, amongst some of the other ones like the bed decompression, the contrast bathing, and the lower body stretching that we talk about a lot on the channel, on the program, it's going to be great, but you're going to use those to help you as you're putting strain on your back as part of your proper rehab work. Now, you hopefully know you're not going to be sliding the spondy back. That's just not going to happen. But your job now is to stabilize that area of the lumbar spine, to do the few bits that I'm going to talk about in a moment in conjunction with this stretch and some of the other relief-based work to really rebuild the strength and integrity to overcompensate for this area of weakness in the lumbar spine. And if you do this successfully over a long enough period of time, you will find you can get back to things you thought weren't going to be possible. So we'll finish up this video with those 3 key principles, more so looking at the rehab for the long term. So number 1 is going to be you have to learn to control the neutral spine. That is, prevent the spine from moving one way or other. That's using the core set of muscles. That's your deep core muscles such as the transverse abdominis, the obliques, etc., the lumbar muscles as well, and working those, blending them together to really provide a solid base of support that prevents this spine from moving one way or other. You need to develop that control in real-world movements, and we suggest starting off with exercises like the dead bug and marching bridge can be great ones, building that into the squat and the hip hinge, and then building those with load over time. Following on from that, point number 2 is you need to make sure that your legs and back are stronger than your average, stronger than those your age, stronger than those that want to do the things that you want to do, because that is going to offset this vulnerability down here. Let's face it, it might not be a long-term problem, but it would be better if you didn't have it. And therefore, if you compensate by having stronger than the average leg muscles, hip muscles, or stronger than the average in the lower back and in the middle back, then you're going to be more structurally sound to offset for that weakness in this particular area. And then the final part, which is really important, and also important that it comes last as well, is that we have greater than average mobility at the level of the hip, the knee, and the ankle. Why is this important? Because the activities of daily life are going to demand that our lower back gets involved at some point or other. Whether it's bending down to tie your shoelaces, you're not going to be able to do that without some involvement of the lower back. Picking your child up off the floor or moving a bag of compost, down to the bottom of the garden, you're going to involve your lumbar spine one way or other. But if we have greater than average hip, knee, and ankle flexibility with great spinal control and strength in the back muscles and leg muscles, then you're going to be able to allow those hip, knee, and ankle joints to do more of the motion so that your lower back has to get involved a little bit at the end, but not straight away from the start. You look at someone that has poor health and mobility and strength in those joints, and they'll end up crowning their lower back over, which is going to be tremendously bad for someone with a spondy, or really someone with any sort of back injury. Instead, offsetting this problem by having greater mobility in those hips, knees, and lower back, hip, knees, and ankle will mean that you can preserve that lower back and its integrity and keep it in the best possible position to do the movements that you're doing. So there we have it. I do hope you found this video helpful, and that if you had some concerns over this great stretch, you now understand it a little bit better and can appreciate why it is such a great tool and why it might be a bit difficult to start with, but you've got the framework to actually be able to do it effectively. Some of the exercises that we've covered on this video, we've got tutorials for, we've got exercise videos for, and you can check the relevant links down in the description for some supplementary material to help you with this particular topic. If you know someone else that's been struggling with their spondylolisthesis or back pain in general, then consider sharing this video with them. Hopefully it'll help them too. And as always, thanks if you made it this far through the video. We hope you found it helpful, and we'll see you in the next one.